If you're over 60 and taking medication for your blood pressure, there's something you need to hear, because what I'm about to tell you could quietly be affecting your kidneys right now, and you may not feel a single warning sign. I've seen this happen too many times. Patients doing everything right, taking their pills daily, following doctor's orders, and yet, months or years later, they're suddenly facing declining kidney function. And they're shocked, because no one ever told them this could happen. Before we go further, if you care about your health and want to stay informed about things most people overlook, take a second to like this video and subscribe. It helps more people hear information that could truly make a difference. Now let's talk honestly. Blood pressure medications save lives. They reduce the risk of heart attacks, strokes, and serious complications. But here's what most people don't realize. Not all medications affect your body the same way over time, especially your kidneys. Your kidneys are incredibly sensitive organs. They filter your blood every minute of the day, removing waste, balancing fluids, and regulating essential minerals. But they rely heavily on stable blood flow and pressure to do their job properly. When certain medications alter that balance too aggressively or for too long, it can quietly put stress on these organs. And here's the most concerning part. Kidney damage doesn't usually cause pain in the early stages. There's no alarm bell, no obvious signal. You can feel completely fine while something important is slowly changing inside your body. What I'm about to share isn't meant to scare you. It's meant to help you become aware, because awareness is what allows you to ask the right questions, monitor your health more closely, and protect yourself. Most people assume that if a medication is prescribed, it's completely risk-free long-term. But medicine doesn't work that way. Every treatment has benefits and potential downsides, especially when age, hydration, and other conditions come into play. And after 60, your body processes medications differently. Your kidneys are naturally more vulnerable. What worked perfectly at 45 may not behave the same way now. So the real question is this. Are you simply taking your medication, or do you truly understand how it's interacting with your body? Because that understanding could be the difference between prevention and regret. And what I'm about to tell you next might surprise you even more. One of the most commonly prescribed types of blood pressure medications, especially in older adults, are diuretics. You may know them as water pills. They're often given to reduce fluid buildup and lower blood pressure by helping your body release excess salt and water. On the surface, they seem simple, effective, even harmless. But here's what most people don't realize. When used over long periods, especially without careful monitoring, diuretics can place a quiet strain on your kidneys. I've seen patients who believed they were just flushing out excess water, but over time, their bodies were losing more than they realized. You see, your kidneys depend on a delicate balance of fluids and electrolytes to function properly. When that balance is disrupted, especially repeatedly, it can affect how efficiently your kidneys filter your blood. Dehydration is one of the biggest hidden risks here, and it doesn't always feel like extreme thirst. Sometimes it shows up subtly. A bit more fatigue than usual, occasional dizziness when standing up, slight muscle cramps, dry skin, maybe even confusion that people mistakenly attribute to aging. What's happening in those moments is that your body may not have enough fluid to maintain healthy blood flow to the kidneys. And when blood flow drops, even slightly, but consistently, your kidneys can begin to struggle. Now, this doesn't mean diuretics are bad. They can be extremely helpful and even necessary. But the key issue is awareness and balance. Many older adults don't adjust their fluid intake properly. Some intentionally drink less water because they don't want to use the bathroom as often. Others don't realize that their medication is increasing fluid loss more than expected. This creates a silent cycle, less fluid in, more fluid out, and gradually the kidneys start to feel the impact. What I'm about to say is something I wish more patients understood, especially after 60. Your body becomes less forgiving. It needs a little more attention, a little more listening. And if no one has explained how your medication interacts with hydration, you may unknowingly be putting stress on one of your most vital organs. So the real question becomes, are you supporting your kidneys while taking your medication, or are you unknowingly making their job harder? Because the next type of medication I'm going to talk about works very differently, but can be just as important to understand. Another group of medications widely prescribed for blood pressure are ACE inhibitors and ARBs. These are often considered protective, especially for the heart and even the kidneys in certain situations. And that's true, to a point. But what I'm about to tell you might surprise you. These medications work by relaxing blood vessels and changing how blood flows through your kidneys. In many cases, this helps reduce pressure and can be beneficial. But under certain conditions, especially in older adults, it can also reduce the filtration pressure inside the kidneys more than expected. I've seen this happen in patients who were doing everything correctly. They were consistent with their medication, following instructions carefully, but their kidney function numbers started to shift over time, slowly, quietly, no pain, no obvious symptoms, just subtle changes in lab results that, if ignored, could progress further. Here's where it becomes important to pay attention. If you become dehydrated, even mildly, or if you're taking other medications that affect kidney function, the combined effect can sometimes reduce blood flow within the kidneys more than your body can comfortably handle. And when that happens, your kidneys may not filter waste as efficiently. This doesn't mean these medications should be avoided. In fact, for many people, they are essential and beneficial. But the key is monitoring. Most people don't realize how important routine blood tests are when taking these medications, especially after 60. Those tests aren't just routine checkboxes. They're early warning signals. They show how your kidneys are responding, long before you feel anything. And I've seen too many cases where those signals were missed, delayed, or misunderstood. What I always tell my patients is this: your medication doesn't work in isolation. It works within your body, your hydration levels, your age, and your overall health. Everything is connected. And when one part shifts, it can influence the rest in ways that aren't always obvious at first. So the real power doesn't come from fear. It comes from understanding. Because once you understand how your body responds, you can take simple, proactive steps to protect it. And what I'm about to share next is something that often goes completely unnoticed, yet plays a major role in kidney health. Let's talk about something that almost no one connects to kidney health until it's too late: over-the-counter medications and daily habits. I've seen patients carefully follow their prescribed blood pressure treatment, but unknowingly add stress to their kidneys through things they considered completely harmless. Pain relievers, for example. Many people over 60 regularly take medications for joint pain, back pain, or headaches. It becomes part of daily life, something routine. But certain types of pain relievers, especially when used frequently, can reduce blood flow to the kidneys. Now imagine this for a moment. You're taking a blood pressure medication that already influences how your kidneys regulate blood flow, and then you add another substance that may further affect that same pathway. Individually, each may seem manageable, but together, over time, the combined effect can become significant. And here's what makes it even more concerning. This combination doesn't usually cause immediate symptoms. No sharp pain, no sudden warning, just a gradual change. A slow shift in kidney function that many people only discovered during routine testing, or sometimes much later. What I'm about to say is something I want you to remember. Your kidneys don't just respond to one thing. They respond to everything you put into your body: medications, hydration, salt intake, supplements, even herbal remedies. And while many of these may help in certain ways, the combination matters. I've seen individuals who believed they were supporting their health by adding supplements or herbal teas without realizing how those additions interacted with their existing medications. Again, this isn't about avoiding everything. It's about awareness. It's about asking, how do these pieces fit together? Because after 60, your body's ability to compensate is different. It doesn't bounce back the same way it once did. And small, repeated stresses, ones you don't even feel, can begin to add up. So the question becomes, are you looking at your health as separate parts or as one connected system? Because the way you answer that question can quietly shape your future health. And what we're about to talk about next may change the way you think about your daily routine entirely. Let's talk about something incredibly simple, yet surprisingly powerful: your daily hydration and salt balance. Most people don't realize how closely these two factors are tied to both blood pressure and kidney health. I've had patients tell me, "Doctor, I don't drink much water because I'm not that thirsty." And on the surface, that seems reasonable. But here's the truth. Thirst becomes a less reliable signal as we age. By the time you feel thirsty, your body may already be slightly dehydrated. And if you're taking medications that influence fluid balance, that mild dehydration can become more significant than you expect. Your kidneys rely on adequate hydration to filter waste effectively. Without enough fluid, that process becomes less efficient. At the same time, salt intake plays a critical role. Too much salt can increase blood pressure and place extra strain on both your heart and kidneys. But too little, especially if combined with certain medications, can disrupt the balance your body depends on. It's not about extremes, it's about balance. And this is where many people unknowingly struggle. They reduce salt drastically, increase medications, and unintentionally create a situation where their body is working harder to maintain equilibrium. Or they consume hidden salt through processed foods without realizing how much they're actually taking in. What I've learned over years of practice is this: small daily habits matter more than most people think. Not dramatic changes, not complicated routines, just consistent, balanced choices. Drinking enough water throughout the day, being mindful of salt intake, paying attention to how your body feels, not just when something is wrong, but when something feels slightly off, because those subtle signals often come first. And when you start noticing them early, you give yourself the opportunity to adjust before anything more serious develops. That's the difference between reacting and preventing. And what I'm about to share next is something many people ignore until it becomes impossible to overlook. Let's talk about the early signs your kidneys may be under stress, the ones most people dismiss. Because I've seen this pattern too often, a patient notices something small, something easy to ignore, a little more fatigue than usual, slight swelling in the ankles at the end of the day, changes in urination patterns, maybe going more often at night, or noticing foam in the urine. Individually, these signs don't seem alarming. They're easy to blame on aging, weather, or daily routine. But together, they can tell a different story. What I'm about to tell you might change how you see these symptoms. Your body rarely jumps straight into a serious condition without giving subtle hints first. The problem is, those hints are quiet. They don't interrupt your life dramatically. They don't force you to stop what you're doing. So they get overlooked. And when that happens, months or even years can pass before the issue becomes more noticeable. By then, the conversation often shifts from prevention to management. That's why awareness matters so much. Not fear, not anxiety, just awareness. If something feels different in your body, even slightly, it's worth paying attention. It doesn't mean something is wrong, but it gives you a reason to check. A simple conversation with your doctor, a routine blood test, a quick review of your medications. These small steps can provide clarity, and clarity is powerful because it allows you to make informed decisions, not reactive ones. I always remind my patients, your body speaks to you in whispers before it ever raises its voice. And the sooner you start listening, the more control you have over your health. Now there's one final piece to this that ties everything together, and it may be the most important one of all. If there's one thing I want you to take away from this conversation, it's this. Your medications are only one part of your health story. They're important, often necessary, sometimes life-saving, but they don't replace awareness. They don't replace regular monitoring. And they don't replace the role you play in understanding your own body. I've seen two types of patients over the years: those who simply follow instructions, and those who stay curious, who ask questions, who notice changes, who take an active role in their health. And the difference between them is often significant. Not because one is better, but because awareness leads to earlier action. And earlier action can make a meaningful difference. So if you're over 60 and taking blood pressure medication, here's what I gently encourage you to do. Stay consistent with your treatment, but also stay engaged. Ask your doctor about your kidney function tests. Understand what your numbers mean. Keep track of changes over time. Pay attention to hydration. Be mindful of additional medications, even over-the-counter ones. And most importantly, listen to your body, because it's always communicating with you, even when it's quiet. What I'm about to say may sound simple, but it's incredibly powerful. Health isn't just about treating problems, it's about understanding patterns, noticing changes, and responding early. That's how you protect not just your kidneys, but your overall quality of life. And if this message made you think differently about your health, even for a moment, then it's already done something important. Because sometimes the smallest shift in awareness can lead to the biggest change over time.